So the name PCOS, polycystic ovarian syndrome, again goes to ovaries. But you already said that so many of your patients come in for something that may not have to do with a cycle or a period, but weight gain. And no matter what age or stage a woman might be in, that's one of the things I see that impacts their life. So when we think of PCOS, obviously we've said it's a whole body system issue. What would you say from a nutritional standpoint is some of the key things that you talk to your patients about?
Yeah. And this is something that's differed over the years. I think when we were training, there was such an emphasis on periods, on ovulating and fertility. And now we know so much more about the impact with blood sugar levels, insulin resistance, wellness, et cetera. It's about, you just nailed it, whole body management, about nutrition, about exercise, et cetera. Now we know a little bit more. Somebody with PCOS, especially if they are overweight or obese, may benefit from something like a low carb diet that we may need to kind of watch the glycemic index of the foods that they're eating. I very often send my patients to see a registered dietitian, at all different weights. It's not about just losing a certain amount of pounds. It's about making sure they're eating a balanced diet, that they aren't accidentally, spiking their blood sugars and things like that. So it is a very important part of how I talk to my patients and about the team that we assemble to help them achieve those goals. So very common that I'm sending them to a registered dietitian to kind of help figure out, what they should be eating, what kind of sneaky sugar pockets are in certain foods that they may not realize, and that sort of thing.
And I do the same thing. I send them to a registered dietitian because I want them to get the expertise based on their body type, their body frame, maybe ethnicity, but also maybe the foods that they're used to, where you can still have, a curated diet that is within the foods that you like, but just tweaking it just enough. The body really is and thrives to be this well-oiled machine. And that doesn't necessarily mean that it has to look a certain way, but it does like to function a certain way. And internally, the more I teach my patients about what's going on internally and having them kind of connect the dots, makes them want to be able to do the work outside of the office. You and I see patients in the operating room, in exam rooms, and back in the day, in labor and delivery rooms, not so much anymore. But outside of those rooms, it really is giving patients the agency to say, okay, now what can I do outside of the office or the operating room that I can take control of my life? And nutrition is one of those fundamental things that they ultimately have the power to change and then see how their health can actually be at their best. And with nutrition, obviously hand in hand goes exercise. So nutrition and exercise are those things that are going to optimize our health and things that people can do outside of the office. So when it comes to exercise, what do you tell your patients?
Yeah. And so really quickly before we jump into the exercise, what you said about making it sustainable for someone's life. I think in the past, we used to have such an emphasis on like the weight and the certain number of pounds or, do X, Y, and Z regimen or eat certain amounts of calories. Now it's about making sure that, it's healthy, it's sustainable, it fits their life. Because like you said, like different people like eating different foods. They, like have certain, preferences for things. So it's all about sustainability and health. So same thing with exercise for, people who are wanting to lose weight or just to kind of get healthy in general. We obviously have a balance of, your cardio for your heart health and maintaining your metabolism, strength training and, building your muscle. A lot of times people forget the strength training part.
Yeah.
They're so focused on cardio and just revving their heart rate. But obviously you have to pair it with, maintaining your muscle. Muscle that also, maintains your metabolism. So actually, since you're the fitness expert, I would love to hear how you counsel your patients about exercise and PCOS.
Well, I'm glad you think I'm a fitness expert, but I'm really not. But I do love exercise, and I do spend an exorbitant amount of time talking to my patients about exercise. And when we're talking about PCOS, you said one thing that's like vital to how we utilize glucose is our muscles. And strength training is going to build your muscles. And we know that muscles really absorb the most glucose out of our body anyway. So the more that we do strength training. We're going to absorb that glucose, which is going to help the body utilize it and get it to where it needs to be. And then decrease those blood glucose levels, which again is kind of like that axis on what PCOS rotates around. So I love to tell my patients, what do you like? I always put it back into their lap and saying, one, what do you know about exercise? What do you hate about exercise? And then let's find something that's going to work for you. Let's find new things that might be appealing to you. And the sustainability part is probably the most thing that I focus on, because it's not about where are we going to be in 3 months. I want to know where you're going to be in 30 years. And if we can start something slow and easy and something that you can work into and that you enjoy doing, the more likely that it is that it's going to be sustainable. I do think we spent a lot of decades focused on women and exercise being more cardio focused, and men could only do weight training. And now we are seeing with women's body and physiology, especially in mid-age, as we start to increase our age, we're going to become more insulin resistant. Glucose is not going to be shuttled where it needs to go. And specifically with PCOS, that's what it thrives on. It's really waiting for glucose to hang around. So we want to get it out of the blood and get it into the muscle. So strength training is one of the most beautiful things that someone can do. So we have to find ways to make it more appealing.
It something that they could love. Exactly.
Now, in addition to that, so now we have nutrition and exercise, but as physicians, our kind of appeal to how to make people better comes with medications. Medications do work. Medications are not needed for everyone, or not everyone has to take them, but there is very good utility to what medications are and how they can provide, a really fundamental basis for people to be better. PCOS and medications. What are some medications when we talk about weight loss medications and when we talk about glucose?
So obviously, nowadays everyone's talking about the GLP-1 medications. And so, again, you can kind of think of them almost as if they were for diabetes, but they also work in other different ways besides, blood sugar management, also about, the motility of your gut system and also feeling full and satiety. So they work in lots of different ways. Like you said, it's not that obviously we don't think that everyone needs medications, but for those people who have optimized everything else in their control. So they've watched, what they're eating, they've worked with expert, registered dietitians on nutrition, they've, really kind of fine-tuned their exercise regimen, and they're still needing that extra help. So that's where the role of medications comes in.
Yeah, GLP-1s to me are this formidable, revolutionary, innovative way of using medications for so many different features. Now, you and I, when we practice, we use medications for other things, even though they may be intended for one thing. But GLP-1s is kind of like that groundbreaking medication that now we're seeing impact so many different organ systems. We have seen that it obviously helped with diabetes. We've been using those for decades, but now with weight loss, quieting that food noise, again, improving our satiety so we're not intaking as much as we used to, which is going to help with decreasing the amount of calories that we intake. But also it helps with glucose utilization. What are we seeing now in research? We're seeing how it's impacting heart health, sleep apnea.
I was just about to bring up sleep apnea, as now it's indicated for sleep apnea, which we haven't even touched on, but sleep apnea also influences things like your insulin levels, your cortisol, your weight balance, and that actually is really key. So again, it's not even just working on the blood sugar, but all of these other features.
And I think that we are starting to see in medicine in general what the body is that it's all connected.
It's all interconnected.
And how we were, taught and how we actually inform our patients and educate our patients used to be so organ-based and so system-based. But now that we're exploring and expanding and how the body all works in synchrony and how it wants to work together, I think is where we're going in medicine. That's the future of medicine and wellness and longevity, is how can we make sure that people understand this impacts this, and when I make this better, this will become better. And PCOS is one of those diseases and syndromes that we see. If I can change this, then my ovaries might change this, or my heart health might change this. And so that's what I love about this education, is that we have come such a long way when we think about what we learned in the textbook about PCOS. How many years ago? We won't say how many years ago. We're not going to tell everyone how many years ago. Up until
we are
now.
seasoned
Yeah, we
doctors.
are seasoned doctors. But now what we're seeing with PCOS, to me, is so much more reassuring and makes people feel that it's not just a reproductive health issue.
Exactly.
Stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.